Gentlemen over 50, listen to me carefully. If you've been waking up and feeling nothing down there, if that natural morning strength you once relied on has quietly disappeared, I need you to understand something that most doctors will never tell you. You are not broken. Your body hasn't given up on you. What's happening is that your system has simply gone silent, waiting for the right signal to wake up again. I'm Dr. Lila Romano, a board-certified urologist with over a decade of experience helping men restore their vitality, circulation, and confidence naturally. Today, I'm going to reveal two powerful pressure points that can reawaken your body's natural response, improve blood flow, and bring back the morning strength you thought was gone forever. No risky pills, no expensive treatments, just 5 minutes a day using your own hands. Stay with me until the end, because what I'm about to share could completely change how you feel when you wake up tomorrow morning. Here's the truth that most men over 50 never hear. The loss of morning erections isn't because your body is too old. It's not because testosterone has completely dried up. And it's definitely not because you've reached some inevitable deadline where everything just stops working. What's actually happening is far simpler and far more fixable than you think. Your body operates like an electrical circuit. Your brain sends signals through your nerves to your blood vessels, telling them to open wide and allow blood to flow into the erectile tissue. When you were younger, that circuit was clear, strong, and responsive. But after decades of sitting for hours every day, chronic stress tightening your pelvic muscles, and shallow breathing that starves your tissues of oxygen, that circuit starts to weaken. The wires are still there. The power source hasn't died, but the connection has faded. Think of it like a light switch in a room you haven't used in years. The electricity is still flowing through the walls, but because nobody's touched that switch, the room stays dark. The moment you walk in and flip it on, the light returns instantly. That's exactly what's happening in your body right now. The power has always been there. You just need to know which switches to activate. I've spent over a decade working with men in their 60s, 70s, and even 80s who believed this part of their life was over. But once they learned how to reawaken the nerve signals and restore blood flow to the right areas, everything changed. Their energy returned, their confidence grew, and they started feeling like themselves again. Not because of medication or complicated procedures, but because they reconnected the circuits that were always meant to work. Let me tell you about Richard, a 69-year-old retired firefighter who came to my office completely defeated. He told me, "Dr. Romano, I don't even feel like a man anymore. I wake up feeling nothing." He had tried supplements, changed his diet, even started exercising, but nothing seemed to make a difference. I looked at him and said, "Richard, your body isn't the problem. The problem is that nobody's taught you how to talk to it." Within 3 weeks of learning the two pressure points I'm about to show you, Richard called me with excitement in his voice. He said, "I felt warmth again. I felt a pulse. Something is coming back." That shift from hopelessness to possibility changed everything for him. What Richard discovered, and what research from institutions like the Mayo Clinic and Cleveland Clinic confirms, is that targeted stimulation of specific nerve-rich areas can restore pelvic circulation and reactivate the reflexes that control erections. This isn't about building muscle or forcing your body to perform. It's about waking up the internal control systems that have simply been asleep. By the end of this video, you'll know exactly where these two pressure points are located, how to stimulate them safely, and what signs to look for when your body starts responding again. All it takes is 5 minutes a day, but the results can bring back the vitality and confidence you thought were lost forever. The first pressure point sits in a place most men never think about. It's located between your scrotum and your anus, in the soft tissue area that medical professionals call the perineum. In traditional Eastern medicine, this spot is known as the root of life, and that name isn't an exaggeration. This small area acts like a master switch that controls blood flow and nerve communication to your entire pelvic region. Let me explain why this spot is so powerful. Directly beneath the surface of the perineum are two critical structures. The first is the bulbospongiosus muscle, which wraps around the base of your penis and acts like a natural pump, helping to push blood into the erectile tissue and keep it there. The second is the pudendal nerve, which carries the signals from your brain that tell your body when to activate an erection. Over the years, as men spend more time sitting, these structures start to lose their responsiveness. The muscle weakens from lack of use. The nerve signals become faint. Blood flow slows down. It's not that they stop working completely. They just fall asleep. And when that happens, morning erections disappear, firmness decreases, and confidence fades. But here's the incredible part. When you apply gentle, focused pressure to this area, you send a direct wake-up call to both the muscle and the nerve. You're not forcing anything. You're simply reminding your body that these systems still exist and still work. Here's exactly how to activate this pressure point. Find a quiet space where you can sit comfortably, either on the edge of your bed or in a chair. Take a small, soft cushion or a rolled-up towel and place it directly under your perineum so that when you sit down, there's gentle, even pressure on that spot. You should feel contact, but not pain, not strain, just a mild, steady pressure. Once you're seated, straighten your back, relax your shoulders, and close your eyes. Take 5 slow, deep breaths through your nose, letting your belly expand as you inhale and soften as you exhale. This kind of breathing is critical because it increases nitric oxide production in your body, a natural compound that helps blood vessels relax and open. Now, shift your attention downward to that base point between your scrotum. Don't squeeze. Don't flex. Just let your body weight sink gently into the cushion beneath you. As you breathe slowly and deeply, you might start to notice subtle sensations. A light warmth spreading through the area. A faint tingling. Maybe even a gentle pulsing sensation. These are all signs that circulation is improving and that your nerves are starting to communicate again. Stay in this position for 2 to 3 minutes. If you don't feel anything immediately, don't worry. For some men, especially those who have been disconnected from this area for years, it can take a few sessions before the sensations become noticeable. The key is consistency, not intensity. Research from the Mayo Clinic shows that gentle pelvic floor stimulation like this improves blood flow to the erectile tissue and enhances nerve responsiveness. It's not about building strength, like you would at the gym. It's about reawakening the control systems that have been dormant. One of my patients, a 71-year-old man named Thomas, described it perfectly. He said, "Dr. Romano, for years it felt like the lights went out down there. I stopped expecting anything to work. But after just a few days of this, I felt a pulse again. Something was coming back to life. That moment changed everything for him. Once he felt even the smallest sign of life returning, his whole mindset shifted from defeat to hope. The perineum is your foundation. It's the root of your vitality. When you wake it up, everything connected to it begins to benefit. Your circulation improves. Your nerve signals strengthen. Your confidence starts to return. And that's just from the first pressure point. Now that you understand how to activate your foundation, it's time to open the second pathway. This one is often completely overlooked, but it's just as powerful. In fact, when you combine both pressure points, you create a complete circuit that restores communication between your heart, your brain, and your manhood. The second pressure point is located along the inner crease of your thigh, right where your leg meets your lower abdomen. This area is home to 2 of the most important structures for male vitality, the femoral artery and the femoral nerve. Together, they form the main highway that delivers oxygenated blood to your entire lower body, including your pelvic region. The femoral artery is one of the largest arteries in your body. It carries blood from your heart down into your legs and pelvis. When this artery is compressed, stiff, or restricted, which happens after years of sitting in the same position, poor posture, or lack of movement, circulation to your pelvic organs slows down dramatically. At the same time, the femoral nerve, which runs alongside the artery, becomes less responsive. This nerve controls sensation and reflexes in your lower body, and when it's compressed or inactive, the signals that trigger erections become weak. Most men don't realize that tightness in the inner thigh can directly affect what's happening down below. But once you learn how to release that restriction and stimulate blood flow through this pathway, you open up a direct route for fresh, oxygen-rich blood to reach the erectile tissue. Here's how to locate and activate this second pressure point. Sit comfortably or lie down on your back with your knees slightly bent. Place your hand on the inner part of your thigh, right where the leg connects to your groin. You'll feel a crease there, almost like a natural fold. Using your fingertips, press gently along that crease, starting closer to your knee and slowly tracing upward toward your groin. As you move along that line, pay attention to any areas that feel tight, tender, or different from the surrounding tissue. When you find a spot like that, pause there. Apply gentle, steady pressure with your fingertips, not hard enough to cause pain, but firm enough that you feel the tissue beneath your fingers. Hold that pressure for about 10 seconds, then release. Move to the next tender spot and repeat. While you're doing this, breathe slowly and deeply. With each exhale, imagine that you're releasing tension from that area. Visualize the pathway opening up, allowing fresh blood to flow freely through the artery and nerve signals to travel clearly. You might start to feel warmth spreading down your leg or up into your lower abdomen. That's exactly what you want. It's a sign that circulation is improving. According to research from the Cleveland Clinic, the femoral artery plays a crucial role in delivering oxygen and nutrients to the pelvic organs. When blood flow through this vessel is restricted, it directly impacts erectile function. Gentle stimulation and regular movement help keep this artery flexible and responsive, which is why walking and stretching are so beneficial for men over 50. But when you combine those habits with focused pressure point work and deep breathing, you create an even more powerful effect. I had a patient named Earl, a 68-year-old truck driver who spent most of his life sitting behind the wheel. He told me, "Doc, my thighs are just for walking. They have nothing to do with what's happening down there." I smiled and asked him to trust the process. After 2 weeks of practicing this technique for just a few minutes each day, Earl called me and said, "Something strange is happening. I can actually feel warmth moving through my body again." 2 weeks after that, he reported waking up with morning strength he hadn't experienced in years. The inner thigh pathway is like opening a gate that's been closed for too long. Once you release the restriction and stimulate the blood flow, your entire system starts to wake up. Fresh oxygen reaches the tissues that need it. Nerve signals travel more clearly, and your body begins to remember how to function the way it was designed to. Now, here's where the real power comes in. When you combine the first pressure point under your pelvis with the second pressure point along your inner thigh, you create a complete circuit. You're restoring full communication between your heart, your brain, and your pelvic region. Blood moves freely, nerves fire clearly, and your body starts responding the way it used to. This isn't about forcing performance. It's about reconnecting the systems that were always meant to work together. And when that happens, men consistently report not only stronger erections, but also better sleep, reduced stress, calmer energy throughout the day, and a renewed sense of confidence. Now that you understand both pressure points, let me give you the exact daily routine that will keep these pathways open and help you maintain consistent results. This entire process takes less than 10 minutes, but when done consistently, it can restore vitality that you thought was gone forever. Here's your morning protocol. Start before you even reach for your phone. Sit on the edge of your bed with both feet flat on the floor. Place a small cushion or rolled towel under your perineum so that you feel gentle pressure on that root point. Close your eyes and take 5 slow, deep breaths, letting your belly rise with each inhale and fall with each exhale. Spend 2 to 3 minutes here, simply sitting and breathing, allowing your body weight to sink into that spot. Next, move your hands to your inner thighs. Using your fingertips, trace the crease from your knee upward toward your groin, applying gentle pressure along the way. When you find tight or tender spots, pause there for 10 seconds, breathe deeply, and then move on. Spend another 2 to 3 minutes on each leg. After you've finished both pressure points, stand up slowly and drink 1 full glass of warm water. Hydration after sleep helps thin your blood slightly, making it easier for oxygen and nutrients to flow throughout your body. It also supports nitric oxide production, which is the natural compound your body uses to relax blood vessels and allow blood to flow into the erectile tissue. Finally, before you begin your day, take 10 slow, deep belly breaths while standing. Inhale through your nose for a count of 4, hold for a count of 2, and exhale through your mouth for a count of 6. This breathing pattern activates your parasympathetic nervous system, which is responsible for rest, recovery, and sexual response. The entire morning routine takes about 5 to 7 minutes. That's it. No equipment, no medication, no complicated techniques. Just gentle pressure, deep breathing, and awareness. In the evening, before bed, repeat the same breathing pattern. Sit quietly for a few minutes and focus on relaxation rather than stimulation. This teaches your nervous system that softness and safety are also part of strength. Over time, this evening practice helps you sleep more deeply, which is when your body produces the majority of its testosterone. The goal here is not perfection. It's consistency. Your body doesn't need you to do this flawlessly. It just needs you to show up every day and remind it that these systems still matter. When you do that consistently, your circulation improves, your nerve signals strengthen, and your vitality returns. Now, before you start, let me give you some important warnings so that you practice this safely and effectively. First, never apply too much pressure. This technique is about gentle stimulation, not deep tissue massage. If you're pressing hard enough to cause pain, you're doing it wrong. The goal is to wake up the nerves and improve circulation, not to bruise or strain the tissue. Second, consistency matters more than intensity. Doing this gently for 5 minutes every day is far more effective than doing it aggressively once a week. Your body responds to steady, repeated signals, not sporadic bursts of effort. Third, if you have any active infections in the pelvic area, recent surgery, or unexplained severe pain, do not attempt this technique without consulting your doctor first. This method is designed for men with general age-related decline in morning erections, not for those with acute medical conditions. If you're taking blood thinners, have a history of blood clots, or have been diagnosed with any cardiovascular conditions, please speak with your healthcare provider before starting this practice. While the technique is gentle, it does stimulate circulation, and your doctor needs to confirm that it's safe for your specific situation. Finally, don't expect overnight miracles. This is biology, not magic. Your body needs time to respond, reconnect, and remember how to function. Some men notice subtle changes within the first week. For others, it takes 3 to 4 weeks of consistent practice before they feel noticeable improvements. Be patient with yourself and trust the process. Let me give you realistic expectations about what to expect and when. In the first 1 to 2 weeks of consistent practice, most men start to notice subtle changes. You might feel a light warmth in your pelvic area during or after the practice. You might notice a faint pulse or tingling sensation. Some men report feeling slightly more aware of their lower body, even if there's no dramatic change yet. These are all positive signs that your nerves are starting to communicate again and that circulation is improving. By weeks 3 to 4, the changes become more noticeable. Many men begin to experience stronger morning erections, increased desire, and better overall energy throughout the day. This is when the body has had enough time to rebuild the nerve pathways and restore consistent blood flow to the erectile tissue. Between 2 and 3 months of daily practice, most men report significant improvements. Morning erections feel firmer and more reliable. Confidence returns. Energy levels stabilize. And many men find that they're able to reconnect with their partners in ways they hadn't been able to for years. The key thing to remember is this: these pressure points are not magic. They are biology. They work by restoring the natural circuits that control circulation and nerve response. Your body already knows how to do this. You're simply reminding it. And with consistent practice, those reminders become stronger until your system remembers how to function on its own again. Gentlemen, here's what I want you to do. For the next 7 days, commit to this simple practice. Every morning, spend 5 minutes activating these 2 pressure points. Breathe deeply, stay present, and pay attention to what you feel. After 1 week, come back to the comments and tell me what you've noticed. Even if it's subtle, I want to hear about it. Your experience might be exactly what another man needs to hear to give this a try. If this video helped you, please hit the like button and subscribe to the channel for more evidence-based tips on men's health after 50. I'm Dr. Lila Romano, and I will see you in the next video.